Good evening to you all. First of all, I must thank Sri Lanka College of Microbiologists, Ministry of Health Sri Lanka, and WHO Sri Lanka for giving me this opportunity to present a lecture for this webinar. My topic is how can pharmacists involved in infection prevention and control to prevent antimicrobial resistance. It's an odd topic. Pharmacist by infection and prevention and control to reduce the antimicrobial resistance. Role and responsibility of the pharmacist. Infection prevention and control is very important in antimicrobial stewardship, promoting the appropriate and rational use of antimicrobial agents. Antiseptics and disinfectants play a major role in infection and prevention. Pharmacists can get involved in advising on the selection and use of appropriate antiseptics, disinfectants, and sterilant, which is really important in infection control. Establishing internal pharmacy policies. Establishing procedures and quality control programs to prevent contamination, educating health professionals, patients, and the public. And contribution to the management of infectious disease and patient safety in the healthcare settings. Precautions taken during compound sterile products preparation. When can medicine cause infections? Infection can occur when pharmacological formulations are contaminated with microbes. This may occur during manufacture or when medications are improperly prepared, handled, stored, or become outdated. Contamination may occur within the pharmacy or in the other areas of the hospital when healthcare workers finalize the preparation of medication and administer them. Contamination of medication and solution occur through three routes: direct contact, use of contaminated ingredients, airborne contaminations. Contamination of intravenous fluids is particularly problematic because of the potential to cause serious illness. If you may remember, in 2005-06 time, there have been huge outbreak of aspergillus contaminated epidural injection caused infection in pregnant mothers, which was very, very serious. As appropriate prescribing of antimicrobials is an important in drug-resistant appearance. Pharmacists should participate in an antimicrobial stewardship programs to optimize the antimicrobial usage in healthcare setting. Antimicrobial stewardships are cost-effective and have demonstrated decrease in suboptimal antimicrobial use. Going back to preparation of compounded sterile products. Example, ear drops, ointments, sprays, etc. There, you have to avoid microbial contamination. Exposure to excessive bacterial endotoxins. Variability in the intended strength of correct ingredients. Unintended chemical and physical contaminants. Ingredients inappropriate quality. So before making the preparation or administering the medications to avoid contaminations, employees should be trained in aseptic techniques. Limit the activities of staff members who exhibit symptoms of infection. Single-dose vials should be used within 1 hour. For products that are reconstituted, only sterile diluents should be used. Very, very important not to introduce contaminant from outside of container into the interior. If liquids is to be injected through a vial membrane, the membrane should be disinfected before being pierced. And syringes that are used to inject medications or liquids to the container should be sterile, single-use, and disposable. And it is recommended to have labeling, dating, and storage of sterile products. Tracking system should be devised in case of a product recall, so such as batch numbers or something, where you can trace the product. Pharmacy area should be kept clean. Food should not be consumed in the areas of drug preparation. Clean rooms where drug prepared should be free of visible dust and access should be limited. Detailed policy should be maintained for the activities allowed in the clean room. So personnel preparing the sterile medication should wear clean clothing, covers and gloves along with the training to ensure proper aseptic techniques. Hands should be washed before and after preparation of drugs. Employees should not prepare sterile products if they have rashes, weeping sores, broken skin, conjunctivitis, or respiratory infections. When preparing sterile or potentially toxic solutions, such as chemotherapies, laminar airflow are strongly recommended not to get contaminated at all. The pharmacist should ensure medications are appropriately handled and stored throughout the institution. Medication should be stored according to the manufacturer's instructions at the correct temperature. All drugs should have appropriate beyond use date printed on the outside of the container when they are prepared. Environment conditions should be checked periodically, including the daily temperature log of refrigerators and the competency of laminar flow airflow workbenches. So, telling everything where things can go wrong. This is an example. An example in a PBU, premature baby care unit. We have had blood culture. This is old one actually, 2015. We had coliform organism isolated from a blood culture of a baby day 6. So it's not a big thing, but it was very resistant one, as you can see. It was sensitive only to imipenem and amikacin. Still, it can happen, but when it comes in multiples, like this, many babies getting the same organism in blood cultures, it's a big worry. So it was a multi-resistant Klebsiella pneumoniae, as you can see here. So why and how? Poor hand hygiene, contaminated infusates, lack of general cleanliness, we have to find. Sample tested, infusates, positive with Klebsiella pneumoniae. Obviously, you can see infusates getting positive with organisms, and infusates are given to the babies, neonates. And then tested each and every component of the infusate, 50% dextrose and other. We couldn't find any organism in the neat components. Then how? That means during the preparation. Regular visit to the PBU, we have seen they initially wash their hands before starting to prepare the infusate, and then in between they use alcohol hand rub, which was prepared in the hospital that time, 2015. And we have, after using hand rub, we have had a handprint after on this blood agar plate. You can see the organism. These all are organisms. So alcohol hand rub has not done at all a good thing. So alcohol hand rub, we checked on it. Locally prepared, no proper updated protocol. Use 70% alcohol as the starting ingredients. You can see 70% alcohol as the starting ingredients, and at the end, we don't know how much alcohol. So introduction of quality assured alcohol hand rub, because that time it was not available freely as now. Immediately commercially prepared alcohol hand rub, and then we started getting prepared for quality assured locally prepared alcohol hand rub using WHO formula and outbreak control. but we had few deaths, neonates, which was very sad. So after following the guidelines as given, you can see first you have to start with ethanol 96% or isopropyl alcohol 99.8%. But the preparation they have used, in the preparation they have used only 70%. So these are the places where we can go wrong, where we can correct ourselves, having good protocols and guidelines. So pharmacists, in reducing the transmission of infection, they do a big role. Should participate in efforts to prevent or reduce the transmission of infection by participating in infection prevention and control committees, establishing internal pharmacy policies, procedures, and quality control programs to prevent contamination of drug products prepared in or dispensed by the pharmacy department, especially in preparation and handling of sterile products. Other considerations include provision for cleaning pharmaceutical equipment, example, lamina, airflow hoods, and bulk compounding equipment, and establishment of appropriate personnel policies, example, limiting the activities of staff members who exhibit symptoms of viral respiratory illness or other infectious conditions. Encouraging the use of single-dose packages of sterile drug products rather than multi-dose containers. Recommending proper labeling, dating, and storage of sterile products and multiple dose sterile products containers if used. And encouraging routine immunization, example, influenza vaccination, now COVID, of hospital staff and others who impact the patient care environment, reducing infections by so. Promoting adherence to the standard precautions by healthcare staff, patients, and others who impact the patient care environment. Striving for zero tolerance of healthcare-associated infection, including surgical site infections, catheter-associated bloodstream infections, catheter-associated urinary tract infection, and ventilator-associated pneumonia by necessary consumables making available for usage. Some other concerns where the pharmacy need to get involved is antibiotic disposal, because at the moment we don't have a good policy for antibiotic disposal. We throw them into the sink or sewage or toilet, making them mixed into the environment. So in the environment, it makes multi-resistant organism. So incorrect disposal causes antibiotic resistance in the environment. So we need to have policies either to incinerate all the antibiotics which are left over, especially in children's hospital, or some kind of policy for all the hospitals. In the summary, the pharmacy plays various roles in infection prevention and safety. The pharmacy should ensure the medications and solutions are not contaminated. Policies should address training of employees and to ensure that they reflect current best practices. Employees with acute respiratory, gastrointestinal, or skin infection should not be permitted to handle medications. To promote rational use of antimicrobials, pharmacists should work closely with the hospital committee and physician to encourage multidisciplinary collaboration within the health system. Pharmacists often have an opportunity to counsel patients and medication and adherence because they give medication to the patient. Proper storage and handling of medication, devices, and medical waste disposal. In all these areas, the pharmacy may have a major impact on the success of an infection control program. Thank you.